Hello, dears, and welcome to Al-Hussaini Virtual Lab, Pathology Talks, Tips, and Practical Tips. Today's tip is really an interesting tip related to the presence of tattoo in the colon. So this is the gross specimen of a colonic resection in which there is blackish discoloration, mostly in the mesenteric fat. Now, on low power magnification, you can see that there is a black discoloration, mostly related to the muscle, but not in the submucosa or in the mucosa. And this is important because one of the differential diagnoses that we should keep in mind, whether this is melanosis coli or not. And remember, melanosis coli is usually confined to the mucosa. It's usually present in the lamina propria. So this is not melanosis coli. So what is this blackish discoloration? Now, on high power magnification, you can see really intense black color residing within what appears to be macrophages within the muscle and the subserosa. And this is really related to the use of tattoo to mark the area of a biopsy, for example, in a case of a polyp or in a case of a cancer, rectal cancer, for which the patient would be receiving neoadjuvant chemotherapy and radiotherapy. So in order to mark the site of the tumor for follow-up, for future resection, they usually inject India ink containing this black color that would tattoo the area of concern for follow-up, for rebiopsy, for evaluation of chemotherapy response, for ensuring that the area that is resected is really the area that will contain the tumor at some stage. Now, it's important also to remember that in the differential diagnosis, we have to think of malignant melanoma. However, malignant melanoma, usually, it's quite uncommon in the colon. It can occur, but if in doubt, then it's important to go back and look at the history of the patient, because often this is really not, this piece of information is not told to the pathologist. However, it's usually present within the medical notes of the patient. This is another example of a less intensity tattoo within the colonic wall, yet from another case for which the patient underwent biopsy resection of endomucosal resection of a polyp, colonic polyp. I hope you find this tip useful in your daily practice. Thank you.